at Macy's done. We have all kinds of little, like there's notebooks back here. There's little ribbons that you can get. There are memory cards that says always remember on the front and on the back. You can, it says dedicated to and my tribute, just a little something about the person. We hang them up on the wall over there with the end overdose. We have bracelets. We have bags. Honestly, I don't know what in them, but I'm sure it's really cool stuff. We have other bracelets. We have these little keychains that have a long memory card in them, some balls, and a bunch of stickers, stress balls.
We do have t-shirts for y'all attending today, but you'll get them after the training.
Yes.
So again, appreciate you guys coming out and being aware of the message that we're sending today, which is that, you know, we can all work together to end overdose and combat the stigma of drug addiction, substance use disorder. And then today is Overdose Awareness Today, and then that leads into National Recovery Month, which is in September. So in September, we will then celebrate the lives of those in recovery from substance use disorder and what recovery looks like to everyone.
We also have a few snacks in there. We have some leftovers from yesterday's meal. Pick your plate or take something to go. We also have meatballs with grape jelly and barbecue sauce and cocktail sausages with chili sauce. So
Yeah,
eat something to eat, come back, talk to people, socialize.
absolutely.
Mhm.
Okay. So one of my many hats is an Overdose Lifeline trainer, and Overdose Lifeline is a nonprofit out of Indianapolis founded by Justin Phillips. Justin Phillips is definitely a hero of mine. She lost her son to a fatal overdose years ago and has poured her life's work into changing legislation to allow lay persons like us who are non-first responders access to use Narcan, as well as protections in the law that protect us from criminal suit for administering Narcan. She has created education and advocacy and harm reduction and does a lot of work with youth and prevention across the state. And she actually, a lot of this is now a national model. So I always like to give props to her as a human and Overdose Lifeline as an organization. If you aren't aware of them or their website, the handouts here have Overdose Lifeline on the bottom, so you can check out overdoselifeline.org for all sorts of resources. Okay, so today I am talking about Narcan or naloxone training. That would take 30 seconds and then you would be on your way, because it's a quick squirt in the nose, and we'll get to that at the end. But it's a very broad overview of several things that lead us into why we need to know how to use Narcan. So first section appropriately is addiction and substance use disorder, and what is that, right? So we understand addiction as a chronic disease, right? Like addiction and substance use disorder, I will use interchangeably today. But we can all agree that it's not just a lack of willpower, right? Yeah. Because for me as a person in recovery, when I realized when the light bulb went off that I was addicted and I couldn't quit, that light bulb going off didn't enable me to quit, right? Because I have a disease at that point. And so the ability to stop using is no longer there without like intervention, treatment, recovery, support things. The driving force in substance use disorder is dopamine. So we all have dopamine freely flowing through our body right now. It's a neurotransmitter that's supposed to be there. If you guys got up and got a plate of that delicious food and jelly meatballs that Connie made, probably, you would go, oh, that feels good. And that feels good is dopamine releasing, saying, food good, need this to survive. That's what it's meant to do. So it programs our brain to say, this feels good. Now I know I need it to survive. And it also does that when we get a good night's sleep, when we're socially interacting with other people, when we are exercising, and all of these things have that correlation with surviving, right? So if I did a drug and then I quickly got this massive rush of dopamine, unlike anything else could give me. Give this gentleman a chance to come in. Welcome. Come on in. So if I use a drug and I get this huge rush of like, this feels good, right? What is it quickly going to tell my brain? Say that louder. That I need that to survive, right? It's not just a matter of, oh, they're doing it because it feels good, right? It's programming my survival hierarchy in my brain to say, I need this to survive. So it jumps the line in front of food, water, shelter, social interactions, which is why when we are in active use, what are we not doing? I'm not eating. I'm not interacting with people. I'm not doing the things I need to survive because drugs have jumped the line and give me more dopamine than a glass of water, right? And so that's when the actual disease of addiction happens in the brain and changes, physical changes occur. The good news is that we can recover. The brains can heal, but it takes a period of time without those drugs for it to start pruning away those old pathways. Questions, thoughts? I despise talking at people for an hour. So if you do have like a thought or if something I say resonates with you and you want to just blurt something out, please, I invite you to do that. But otherwise, we'll just continue talking again. Okay. I also get ahead of my slide. So as I just said, addiction changes both the structure and the function. What began as a choice, maybe I will try this because I'm stressed out, or maybe I grew up around it and it's normalized and I have environmental factors or whatnot, right? It is no longer a choice once the disease sets in. I become hardwired for that, and it's critical for my survival. I always do this comparison, and I'm going to do it. Have you guys seen the original Men in Black? Okay, it depends on the room I'm in. Yeah. Okay, I do this for high school students, and sometimes I get like yeses, and sometimes I get nos, and I'm like, okay, I'm leaving. So there's a scene in Men in Black where the guy in the cafe gets killed by like the bug man, and his brain opens up, and there's this teeny tiny little cute alien with joysticks. That's what I picture is like addiction. Like this is me on the outside, but I'm no longer in the driver's seat. However, my disease of addiction is not that cute. Okay, it's ugly and mean and like ruthless, but you get the general comparison. So we know that approximately 20 million Americans are symptomatic with their disease. So that means their disease is active, they have symptoms. And then approximately 23 million Americans are living in recovery, like myself and several in the room. So we're non-symptomatic. Our disease is not active. We are not having active symptoms. We're using this disease model, this conversation, similar to like diabetes, right? Am I having symptoms? Am I not having symptoms? Is my COPD flaring up or am I not? Am I having congestive heart failure symptoms or am I not? Am I doing the things I need to stay in recovery or have I had a recurrence? Substance use disorder is a chronic disease. What does that mean? What does chronic disease mean? Ongoing. Perpetual, progressive, lifelong, can be fatal, treatable. That's the word that I hang on to. It can be treated, right? We can recover. However, just because I haven't used in almost 10 years doesn't mean that I don't have the disease of addiction, right? I have to work to remain in remission from my disease. And everybody's recovery and remission looks different, right? So 43 million Americans are affected by substance use disorder. And that's just the individual. We know that this is a huge butterfly effect of family members losing loved ones, right? The things that we do to get stuff hurts others, right? So a lot of the country is affected by substance use disorder. All right, we're going to pivot a little bit and talk about language. And you're going to be like, why are we talking about language at a Narcan training? So a second ago, I stood up here and I said, hi, my name's Macy. I'm a person in long-term recovery from substance use disorder. I did not stand up here and say, hey, I'm Macy. I'm a junkie, meth head, heroin addict, you know, whatever, here to do your training. What's the difference?
How people take it.
How people take it. Yeah. Now in this room, welcomed, right? A lot of us are 12 steppers. Hi, I'm Macy, I'm an addict. But out there in the real world, in the not sheltered world, calling myself those things is not received well. People tend to think of, oh, she's going to spread a disease or she's going to steal my purse and, you know, all the things. And in order to change the stigma associated with the disease of addiction, we have to change the language we use with people that don't understand it. So I'm a person first. I'm not defined by my disease. So I'm a person living in recovery from substance use. I'm a person living in recovery from mental health issues. I'm a person that is living in recovery from hepatitis C, right? I'm a person first. I'm not defined by my disease. And so I invite all of you guys to kind of think about how you talk about yourself and how you talk about others in your day-to-day life, and just how much better you feel about yourself when you start talking about yourself better. And then also, if someone's using the wrong language, be nice. You know, find a nice positive way to kind of shift it. When I'm working with folks that are trying to get into recovery, a lot of times it's like coming in and being like, I didn't get the job because I'm just an effing felon and I'm just an addict and blah, blah, blah. And I'm like, whoa, whoa, whoa. You're a person with a disease and you're working to be in recovery. Like, practice saying that. And when they practice saying that, I see them lift up. I see their self-esteem change. So words do matter. I also understand being politically correct can be very challenging in a world where language is always changing, because things can gather stigma like a bad snowfall effect very quickly. And so when I first got into the field, relapse wasn't a bad taboo word. Now we know that the term relapse, a lot of people hear and they're like, oh, they just screwed up again. They've relapsed. They've gone back out. It's kind of starting to get a negative vibe. And so instead of saying relapse, we might say they've had a recurrence, or their symptoms have, you know, recurred. They've had a setback. They've resumed use. That's a tricky one. And I understand that that's going to be hard for everyone to change, but that's kind of like a thought stretcher. Some easier ones that we can do are, instead of saying a dirty drug screen or a clean drug screen, call it like it is. What is it? Is it positive for substances, or is it negative for substances? Why is it clean or dirty? And what does that imply? It implies that the person is clean or not, right? So those of you on probation, your probation officer saying you've got a dirty screen thing, you know, well, maybe be a little careful about how you go about that, but celebrate your wins and, you know, say, yeah, my screen was negative today instead of clean. Let's see. I think I covered all of those. Any thoughts, questions, or like, didn't think about that? That makes sense, or anything with language? I would say, like, you're not going to get an F and get kicked out if you use it, but it's just something to be mindful of.
It's interesting how certain terms are so ingrained
Oh, yeah.
in just that world.
Mm-hmm.
You know, I mean, I never before today, I would have thought of changing up saying relapse
Yeah.
to reoccurrence.
Yeah.
But it makes a lot of sense.
Yeah.
Because we absolutely are people first. We aren't defined by our actions.
Yeah.
You know what I mean?
Yeah.
It has a profound effect also on the way we think about ourselves.
Mhm.
You know, when we're using appropriate language or affirmative or proactive language, it gives us an opportunity to step forward into that or confirm what we're actually doing in our lives. And I love that you touched in on dirty and clean, because that's so important. You know, like, we associate things that are dirty with something that is diseased and untouchable. And the person first perspective is really, really important, and gaining access to, like, stepping away from isolation and into community.
Yeah, absolutely. And like I said, I mean, there are multiple pathways to recovery, and in 12-step rooms, like I'm definitely using language that I don't use outside of my 12-step fellowship. But it's just one of those like thought-provoking things, right? Like, and how I think about myself and how I talk. All right, thank you guys for sharing. We're going to move on to opioid overview and fentanyl 101, because this is kind of the driving force of our opioid or our overdose epidemic today is opioids. And what are they? Why are we here? What happened, right? So the family of opioids, and I guess I should say trigger warning potentially for those. This could be this slide could be a little activating for some folks. So if you feel activated or you need to talk, Connie's in the back of the room, and we have several amazing recovery coaches here that would love to step out with you and give you a moment. But for opioids, we have natural, which is morphine, opium, and codeine. And then we have semi-synthetic. So what does synthetic mean?
Manufactured.
Yeah, man-made. So it's derived some from that natural component and some of it is man-made. What I like to point out in this slide, if most of you can see it, is we have Vicodin, Percocet, and oxycodone. We've all heard of those, right? Okay. So welcome. Come on in. In the same category as oxycodone, Percocet, and Vicodin is heroin, right? And so when I teach anybody, but specifically when I'm teaching youth, I point this out because that means that oxycodone, Percocet, and Vicodin have the same addiction potential and the same overdose risk as heroin. It is just in a different form. And just because it comes from your doctor does not mean that you cannot become addicted, and it does not mean that you cannot overdose from it. Fentanyl and methadone are fully synthetic, they are fully man-made, and they're extremely potent versions of opioids. Fentanyl being 50 to 100 times stronger than the natural derivatives of opioids. My elevator speech on prescription opioids is this: whether you have or haven't, or do or don't have a substance use disorder, anyone can become addicted to a prescription opioid. Nobody is immune to this. And unfortunately, I'm not throwing a ton of shade on all of our healthcare providers, but it tends to be the first thing offered when pain is the issue that we're presenting. And I give an example of my 7-year-old who had to have a baby tooth pulled a year ago. He had to be lightly sedated and have a little teeny tiny baby tooth with like little teeny tiny roots pulled. He's going to be fine. He was fine. They tried to send him home with liquid hydrocodone. If I wasn't living my best life and not in recovery, I would have taken that script for sure. Also, like, what is that doing when we introduce a substance to somebody that young? We know that you're 4 to 5 times more likely to develop a substance use disorder if you start using any sort of controlled substance like that before the age of 15. So that would have ramped up his chances for becoming addicted in later in life. So advocate for yourself. Hey, I'm a person in recovery. If there's a non-narcotic option, I would like to explore that first. If it's still not good, you can always pick up the phone and call. And there are other options. So for him, I was like, no, I'm good. I'm going to do Tylenol and ibuprofen and rotate those. And she was like, oh yeah, that works too. And I'm like, why wasn't that the first thing like that was offered? That's crazy to me. So I'm sure you guys already know this, but like, advocate for yourself. It will always be the first thing that's offered. There are less strong versions out there. Now, in my recovery, I've had like a handful of surgeries and I had a C-section baby. I've had my experience with having to be on prescription medication, but it was always the last resort. And I always had my sponsor in my corner, and I never had full access. I always had somebody giving me my medication. You can have a plan. You can work through those things, but just don't go rogue because your doctor is like, here you go. It's safe because it's the prescription. Remember, it's in the same category as heroin. Just always have that at the back of your mind. Any thoughts on that? Okay. 1 in 4 patients receiving long-term opioid therapy in a primary care setting will struggle with an opioid addiction. And I will say like 95% of the clients that I work with that come in addicted to fentanyl today started with a valid prescription however many years ago. Hard work, mechanic, back injury, car accident, surgery, chronic pain. Can't get it anymore. I need this to survive. Heroin, fentanyl. I've never met a person to this day, and if anybody has, please share, that woke up and just tried heroin without trying anything else or didn't have anything leading up to it. Have you?
No.
Oh. Go ahead.
Gabapentin considered the same area.
It's in a different drug class. Yeah, so gabapentin is not an opioid. It's actually, it's a nerve medication. They treat it, they use it to treat seizures, but they could also use it to treat chronic nerve pain. It can be addictive if you overtake it. We do see that if you are taking more than what you're prescribed. So again, if you do have an addiction history, very good idea to just be very open with your provider and say, hey, let's start low and slow on this. And then make sure that you have an accountability buddy. Somebody that knows like, hey, I'm getting on this medicine. These are my concerns. But no, not an opioid. Good question.
Kayla sort of, she would use pills here and there, but she was 17 and had an older boyfriend that did it and introduced it. She said she never liked the pills. They made her throw up, but she did heroin every day. So, I think they are out there. I think it's weird.
Yeah.
Because I graduated from oxys to heroin. So.
Yeah. Did Kayla use like weed or alcohol or anything
Oh, yeah.
first?
Yeah.
Yeah.
There
So
was
like,
an introduction of something. It just wasn't pills, I don't think.
right. Yeah. Yep. It's very rare. And that's that progression of the disease, right? It like starts here and it ends up there. That's what we mean when it's progressive. Okay, so opioids are central nervous system depressants. So what that means is our breathing and our heart rate, our central nervous system, right? Everything kind of slows down. It's depressing it. And that's why they're effective pain relievers, right? If I break my arm and I have a bone sticking out, I don't want to feel that. I need a central nervous system depressant to slow my nervous system from firing on that pain. And that's why they are effective pain relievers. However, an overdose occurs if I have too much of that CNS or central nervous system depressant firing at once. And then if my heart and my lungs, everything just slows to a stop. And that's when an overdose happens. Tips to reduce a prescription opioid risks. Again, I always get ahead of my slides, are just being proactive with your doctors, talking to your friends, family members, safely storing your medication. This is a big light bulb moment for, I think, a lot of folks, because people just get their meds and they don't think about the storage of their medication. But like, you don't know who's going through your stuff when they're in the bathroom. And especially if you have teens or kids in your house and you have medication, get a medication lockbox. If you can't afford a medication lockbox, please see me because I can get you one, I'm sure. It's just things that we don't think about. And it's really important to ensure that we're responsible for the things in our house that could, 1, become addictive to somebody, or 2, kill them. So locking up our medication is extremely important. And destroying your medication when you're done with it, if you have leftover medication. There's other like places in town that you can take your pills and just pop them in there. They have drug take back days several times a year. You can drop off your medication there. But like, what a concept for somebody that's in recovery. Let me tell you, the idea of having leftover medication didn't occur to me when I was using, because they were gone in 3 days. But or like, why would I give it away? I'm going to save it, or I'm going to sell it, or whatever. Let's be real. I'm putting it on the table. But we're in recovery now, right? We are responsible members of society, and it's important to be responsible for our controlled substances. Fentanyl 101, because there's a lot of like myths and like ghost stories and all kinds of like scary stuff out there about fentanyl. It is scary, but let me just like break it down for you. So fentanyl has been around since the 60s. It's been used in clinical settings for extreme or chronic pain and surgeries. The fentanyl that I get administered after a major surgery from a doctor is not the same fentanyl that's on the street killing people. The fentanyl I get in the OR when I have surgery or the ER is FDA approved and in a vial. The fentanyl that is out there on the street is man-made, and we have no idea what's actually in it. We don't know how strong it is, and it is not FDA approved. Okay. So two completely different things. We don't just have dealers like dripping vials of fentanyl on our stuff. It's completely different. So I say that because if you are in the hospital and you are like in severe pain or you have a procedure and they are offering you that and you decide that's what you need, it's not the boogeyman fentanyl that is on the street killing people. Illicit fentanyl is the primary driver for overdoses today. It's cheap to manufacture. It's very easy to acquire, and that's why it started making its way into the drug supply. A very little bit goes a long way. And so people can make big batches of fentanyl for very cheap, and there's a lot of return for people. Another reason why it started making its way into the drug supply is because it's short acting. It's very potent and it's short acting. So folks that were using heroin, it could maybe last them most of the day before they would start having withdrawals. But if I'm using fentanyl, I have to use fentanyl all day because I'm having a very short acting response and I'm getting sick very quickly. It can come in gray, tan, powder form. It can be injected, smoked, or snorted. As a mom, the rainbow fentanyl thing, it does exist and it scares the daylights out of me, but it essentially looks like Oxy 30s, but in fun colors. And so those are made to get our teens, get our youth. They're more likely to try something that's a fun color, especially if I've already had a couple beers and I'm high. So very scary stuff. And for those of us that are addicted to stimulants and we're like, opioids were never my thing. Like I use meth or I use cocaine. It's being laced in stimulants as well as other opioids and heroin. So a lot of the people that I work with are like, why am I testing positive for fentanyl when I'm only using meth? Because it's in your meth, which means that you're now at a higher risk of overdosing, even though you think you're just using meth. Or you think you're safe because you're not using the thing that overdoses people. That's just, the rules are not applied anymore. Street drugs laced with fentanyl. So when I tell you that there are literal pills out there that look like Oxy 30s, the same color, the same press, just like you would get at Walgreens, they look the exact same side by side. You wouldn't be able to tell. One of them is a lethal dose of fentanyl and one of them came from the pharmacist down the street. That happens. That is happening every day. People thinking that they're getting an Oxy 30 or whatnot, or even an Adderall, or even a Xanax bar. And it looks just like that. And it has fentanyl in it. It's happening. 6 out of 10 of the nearly 60 million counterfeit pills seized by the DEA have lethal doses of fentanyl in it. Fentanyl is the #1 cause of death of Americans between 18 and 45. Let that sink in, right? This is why we're here. This is why it's important to have these conversations. It's important to have Narcan. All right, we're going to dispel some myths real quick. So if I touched a pile of powdered fentanyl, just touched it, is anything going to happen to me?
No.
No. Now, if I touched it and I ate a bag of Doritos, or I picked my nose, or I rubbed my eyes, or I started biting on my fingernails, I'm going to feel that. I'm going to potentially overdose because I've introduced it into my bloodstream, my mucous membranes, or a needle stick. But just by touching a dried pile of powdered fentanyl, I will not overdose. Why is this important and why are people pushing this myth buster? People do not want to respond to someone overdosing because they're scared of touching them. So it's very important that we educate people that that is not the case, but it's also very good practice that if I'm responding to somebody having an overdose, that I don't immediately go and have a snack. Or if I'm a smoker, this is more likely, smoking a cigarette, right? Go wash your hands, just good practice. But please respond to the person. Don't be afraid to touch somebody that they're having an overdose. Just be mindful of where your hands go after before you wash them. Even if the pile of fentanyl dissolves into a liquid and I touch it, it's still fine. Unless, let's say I have a cut on my finger. That could also introduce into my bloodstream. So that's a problem. Thoughts on that? Cool. There are fentanyl patches that are like formulated to absorb into your skin. That's a different ball game. Those are meant to be absorbed into your skin, and those are prescribed by doctors. And I've never met anybody that made a street fentanyl patch, but I do know people that have, used fentanyl patches, etc. But that's the difference. Again, already talked about this. Gonna keep going. If you guys want me to stop, let me know. Okay. Who here has heard of xylazine or trank or zombie? Yes.
I've
Heard of it? What have you heard?
heard that it's a really gnarly, like worse than carfentanil, worse than,
Yeah.
which is another depressant.
I love that you use the word gnarly. I'm going to bring it back into my everyday vocab because I love that.
It makes me, it's like I'm grateful to be in recovery, but I definitely would be scared to get out right now because one, I've never even heard.
Hi, welcome. Hi, come on in.
Know what trank is, or what you know what I'm saying, it's a horse or elephant equalizer or
Yeah.
something. But I'd be afraid to use just for the simple fact that I go back now, I'm not too bad.
Yeah, the drug supply is definitely extremely poisonous and deadly at this juncture. It's just not. I sound like an old lady when I'm saying this, but like it's not the same that it used to be. It really isn't. Okay, so xylazine is a horror story and it's real. So let me break it down for you. So like Narcan, we're gonna get to it. It's a big fix, right, for an opioid overdose. Xylazine is not an opioid, so Narcan won't work on it. Okay. Xylazine is also not meant for human consumption. It is a veterinary medicine. So when humans consume it, bad things happen. Folks tend to get really bad ulcers and skin infections from using xylazine, even if I'm not injecting. I could snort xylazine, take it as a pill, smoke it, and I'm still going to start producing these ulcers on my skin that then become infected, abscessed, etc. So if you're working with somebody or you know somebody that's out there actively using and you notice that they have some sores, it's very important that they go get them checked out because they will progress and they could lose limbs. I've seen several people in the ICU in Boone County, our neighbor, with xylazine sores, being treated for xylazine sores in the ICU. Another thing that happens being a central nervous system sedative depressant is if I use, let's say, a drug that's fentanyl and xylazine, it's very long acting. Again, fentanyl short acting. So now we need to make it last longer. Let's add xylazine in there and leave them both, because that's drug dealer math for you. It's long acting, so I'm going to fall out. I could pass out on the street, right? I could be out for 8 hours. And if I fall out, I might just fall out just like this. My leg's under me, I'm crooked, and I'm there for 8 hours. And when I come to, I've lost blood circulation to my leg. Now I've lost my leg. Or I'm susceptible to sexual assaults or other things, trafficking, all the things. I am out, down for the count for a long period of time. So all of these things are what's happening with xylazine. It can become addicting with repeated use. However, a lot of folks in Montgomery County right now are getting it like unknowingly. So it's just being laced in the drug supply. However, we know that what happens over a period of time is that people then become addicted to that combination and then they start seeking it out. So how do we treat a xylazine overdose even if Narcan doesn't work, right? So again, naloxone will not reverse a xylazine overdose, but it's typically co-ingested with an opioid. So we still recommend using Narcan on somebody that maybe is having a xylazine overdose as well as whatnot. Because if they did have fentanyl and xylazine in their system, it's going to start reversing the effect of that opioid overdose, which is going to help regardless. The first step in responding to an overdose is calling 911. So good news is that hopefully EMS will get there quickly. And if you're CPR certified, it's highly recommended that you begin CPR immediately to help them with rescue breathing and getting their blood flow circulating.
You get in trouble if you do CPR and you're not certified?
I don't know the answer to that question. I feel like you're protected by the Good Samaritan law with CPR and any sort of act thereof, but I can't speak confidently to know if like an official certification or not warrants that protection. But I'm sure a quick Google search would tell us.
As long as you're not grossly negligent, any steps you've taken are protected by this Samaritan law. Even if you're not certified, if you have some idea what you're doing, you're protected. I mean,
Okay.
it's intended to
Yeah.
encourage people to help.
Yeah,
And so unless you're grossly negligent.
correct, right. That's where I was leaning to, but again, not sure. But yeah, if you feel like you know enough of it, or maybe you had a training in high school, but you haven't renewed your certification and you know, staying alive in 2 breaths, like let's do it, before EMS gets there.
I did just Google it and absolutely.
Okay.
Yeah.
Fantastic. And I'm sure a quick YouTube video will give you a quick refresher in like 5 minutes on CPR too. So, all right. Any other thoughts on any of that before we move on? We doing okay? Need to get up and get our wiggles out or anything? Okay. All right. We're getting there. So how did we get here? Why is this happening? Right? Again, this is where we're at. So opioid overdoses weren't really a thing, wasn't really affecting people in the late 90s. It was happening, but it was very seldom. It was just kind of very rare. So 1999 is when Purdue Pharma launched OxyContin into the market. And we'll get into this a little bit more. But as you see, from 1999 all the way up until 2022 and so on, overdose deaths climb, right? From 2019 to 2020, we see a 30% increase in overdose deaths. What happened in 2020? COVID. Yep. So if I'm in recovery, what's the #1 rule? Don't isolate, right? So if I'm already in recovery and I'm isolating, my meetings might be shutting down. I can't access my therapist if that's my mode of treatment. I'm stressed, etc. I'm at risk. If I am sheltering in place or quarantined and I'm by myself, nobody can be around me, who's going to be there to respond to me if I overdose? Nobody, right? Our #1 rule with anyone using drugs is never use alone. Because if I'm using alone, nobody can respond to me. Nobody can call 911. So if I'm alone in the pandemic, I'm at a high risk of dying. And that's what happened. And we lost an unprecedented amount of people in a year's time on top of COVID. And we continue to see a climb of 16% and on. And now we're finally starting to see this teeny tiny little 1% decrease. And I feel like it's because of a lot of this work that we're doing to just get it in the hands of everybody, educate people, educate those that we're working with. Don't get high by yourself. Overdoses are the leading cause of accidental deaths, far surpassing cars and gun violence, as you can see. And the leading cause of that is fentanyl and opioids. And then this is a real quick glance at that trend, as I said. So in 99, OxyContin hits the market. No regulations. Take Oxy for a headache. Take Oxy for just a little bit of an ache and pain. Like if you have any pain when you go to the hospital on that little pain smiley face scale, doctor is going to give you Oxy because doctor gets a payout from the hospital for prescribing it, plus a steak dinner from Purdue Pharma. This happened. Mismarketing. They also told the doctors that it was not addictive. They also told the doctors that they couldn't overdose from it. So it was just being poured into the streets. So we've got legal heroin being written and overprescribed for a good 10 years before the DEA finally started going, man, what's going on? They started putting coding on the oxys. They started doing prescription monitoring so you couldn't doctor shop. But I've already got 10 years worth of folks that are now addicted to their prescriptions and they can't get it anymore. So they started using heroin. Okay. Then we see the heroin wave hit the market and start causing those overdose deaths there. And then people got wise to adding fentanyl into the drug supply, and it just continues to climb from there. Very rarely do we see like straight heroin in the market. Mostly it's laced with fentanyl or straight fentanyl. And again, when Purdue Pharma launched, they targeted the Appalachian, I can't say it. Somebody say it. Thank you. Region. Coal miners, hard workers, lots of injuries, lots of poverty, rural areas. Still to this day, West Virginia is black, like ravaged with overdose deaths. We cannot get ahead of what happened in the past. People are still dying at rapid rates. And we're a neighboring state, so we still see a lot of that here. There's some interesting like mockumentaries, like drama versions of this on TV. So like Dope Sick is on Hulu. It's a good watch. It's a series with Michael Keaton, which I love Michael Keaton. It's a good watch though. They talk about the Purdue Pharma situation if you want to check it out. So 1.2 million Americans have died between 99 and 22. That means 301 Americans are dying every day from overdose, and someone's dying every 5 minutes. If you would like some light reading, please visit the CDC website for your state's drug trends to expand a bit more. We're almost done, guys. Okay, so Macy just like laid on this really thick horror story and I don't know what to do and everyone's dying and I'm really scared. So now what? Harm reduction and overdose prevention is what? So harm reduction is a public health model. We all use harm reduction every day, believe it or not. However, the mindset of war on drugs, drugs are bad, lock them up, has a stigma of harm reduction is bad, it's taboo, it's controversial. Harm reduction that y'all use every single day are bug spray. Like, I don't want Zika virus and like West Nile and this and that, but I'm still going fishing and I'm still going camping. I'm still putting myself in harm's way, but I'm going to mitigate the harm by putting on some bug spray and try not to get Lyme disease, but I'm doing it anyways. I'm driving in my car, even though I could get into a car accident. So I'm going to put on a seatbelt and I'm going to have an airbag. Harm reduction. Vaccines, harm reduction. Designated drivers, harm reduction. Opioid harm reduction is naloxone or Narcan. Because again, the light bulb moment when Macy realized I was addicted didn't stop me from doing all the things that I did. Didn't stop me from using the needle. Didn't stop me immediately from doing all the other harm that I did. So how do we keep Macy safe while she continues to go down this path until she finds recovery, right? Narcan to keep her alive if she overdoses. Fentanyl test strips. So I can now test my supply to see if there's fentanyl in it. And if there is, I'm definitely not going to get high by myself if I still choose to use. But at least I have an informed decision that I can make now, knowing that it's that potent of a drug. Medication-assisted treatment like methadone, buprenorphine, and naltrexone are ways of harm reduction to help us stabilize in our recovery from opioid use. And syringe exchange programs. So we don't have an SSP here in Montgomery County, but I will tell you a fun fact because people tend to have certain feelings about syringe exchange programs. One of the coolest things that happens at a syringe exchange program, all of the syringes collected, one, aren't on the street in the trash can and on the sidewalks. Two, they get sent to the State Department of Health for testing. So they can go, oh, Montgomery County just had 5 HIV positive like syringes turned in. Plus this drug that we've only seen in Philly is in like 3 of them. So we know that this is happening before it becomes an outbreak. Okay, so lots of really good data supporting harm reduction. as well as the compassion of meeting someone where they are, because they're going to use those needles whether we give them to them or not, and they're not going to put them in a place that they need to go if we're not collecting them. Yes.
Is it just politics that they're using, politics and stigma? They're using that Montgomery County doesn't have a needle exchange? Or is
I
that
plead the fifth on politics right now. But the way that the county has decided to respond in general is that if they have watched like where we are with Hep C and HIV, if we started to have a high number, they've considered having it. So if we started to have an outbreak, they would have it. Although I prefer to be like prevention than reactive. But, you know, a lot of times we just like wait and we react to the problem before it becomes a problem. So that's where we are with it. But
Still gotta be careful legally too. If you get given needles, you can still be arrested for it.
that Pepsi can that you have there, sir, that could also be something that I could smoke drugs out of.
Yeah.
It's not until I smoke drugs out of it. So yes, when we give syringes to people, until there's a drug in it and I use it to put the drug in my body, it's not paraphernalia. We know, and the people getting those things and those supplies know that once they use it to put drugs in their body, it's paraphernalia. But the exchange of the supply is not illegal.
Are they in like a sealed bag?
Yeah, they're in like a sterile situation. Yeah.
So really, you should actually follow like the one-time use thing, throw it away. 'Cause then-
Say that you turn it back in. So it's an exchange process. So you turn your old one in, you get a new one.
Without the exchange, yes.
because that's happened to me before. Court harm reduction, a court program gave me clean needles, and I used them and then was arrested for them.
Yeah, because
So
once
it's like,
they're used, they
How
are
do you
paraphernalia.
exchange them legally once they're used? If I get pulled over with them, it's level
It's
6 felony.
it's the very gray area of what happens in between the sites. So like even fentanyl test strips just until very recently were criminalized, even though they were being criminalized as paraphernalia, but they're drug testing equipment. So it just depends on the county, the prosecutor, and how folks react to it.
I just didn't know if there was something you could do to legally do it, to exchange them.
If you have a sharps container, that's probably the best bet. Like we distribute sharps containers because once it's in a sharps container, like I highly doubt anyone wants to dig through a sealed sharp container. You know, like especially if you can take a sealed sharps container with syringes in it to the health department and exchange it for an empty sharps container. So that would be a good way of doing it. Again, like I'm glad to hear conversation around it because it's just a matter of like these things are happening whether we like it or not, and how do we keep them safe and those around us safe?
I agree with it. I was just saying, you could still get arrested.
100%. That's the thing, you know. And so it's a very strange operation, right? So, but the sites do exist, but like substance use don't exist on the site. It's just it's an exchange. So, good questions.
And the truth is, if you're going for a needle exchange, that dirty needle is probably the least of your worries.
Not dirty. I'm gonna give you a flick.
I know. I think it's like that. Gonna be honest here.
No, it was the dirty.
Oh, dang it. You got used. It's probably
No, but I always use the pop can thing. So like, a chief of police, I won't say who, but one that I work very closely with, I always drink out of a jug, right? Because I'm a water freak and I'm also in recovery. So one is too many and 1,000's never enough of anything I do, including water. So he was sitting at a table with me and he was like, well, you know, that water jug right there is a water jug, but it could also be a water bong. It just isn't yet. I mean, and he's like, or the Mountain Dew can. It's like anything, you know, a lot of things can be paraphernalia. I don't know. It was just kind of a nice way to hear law enforcement be like, yeah, exactly. You know? So, okay, here we go. Here's the end. We made it. How are you feeling? Okay. So recognizing and preventing an opioid overdose. So again, central nervous system depressant. So if I use a big or a most potent amount of opioid and my central nervous system gets depressed, everything is slowing down to a stop. My breathing, my heart rate. So I'm going to start to become unresponsive. The first thing I want to do is make sure they're just not taking a little nappy, right? So I want to give them a good painful kind of sternum rub to make sure, hey, I just dozed off, you know. Don't call 911. So I want to make sure they're having an overdose or some sort of medical emergency, and I can't get them to wake up. Hey, Brandy, are you good? Are you good? She's still not coming to. She's turning white. Her fingers are going blue. Her lips are going blue. She's gasping for air. Her breathing is labored and uneasy. She may be vomiting or gurgling a little bit, and very quickly things are decompensating. First thing I'm going to do is call 911 on my phone, and I'm going to put it on speaker, because now my hands are free to help Brandy. Hey, 911, I'm at the Recovery Rec Center. I think someone's having an overdose. I'm at 1300 Ladoga Road. I'm getting ready to administer Narcan. Okay, so I've got Brandy on her back. I'm probably going to get ahead here. Hold on. I'm going to do it anyways. So I'm going to put Brandy on her back. I'm going to lift up the back of her head, and I'm going to use a dose of Narcan in one of her nostrils. Brandy, am I saying your name right? Yeah, I just had like a weird out of body moment. I was like, am I calling her by the wrong name? Can't go. She can't go. She's not breathing. So we want to make sure her head is tilted back. And when I push that dose of Narcan, it can get as far back as it can in her mucous membrane, right? And then I'm either CPR certified. So I'm going to say, hey, 911, I just gave her Narcan, put 2 minutes on the clock. Because in 2 minutes, if she's not coming to, I'm doing another dose of Narcan. And dispatch is there to help you in this just as much as they are to get ambulance there. So they'll put a timer on for you. They'll walk you through CPR. They'll support you through what you're doing. So I'm going to start CPR and rescue breathing on Brandy. Please tell me when it's been 2 minutes. 2 minutes is up. She's still not coming to. I'm going to grab another dose of Narcan because I always have 2 on me because it takes more than 1 these days with the fentanyl situation. And I'm going to push this in her second nostril. Second dose given, continue with CPR. Luckily, I'm in town and I hear EMS rolling in because I did the thing and I called 911 first. And then when they get here, they can continue to respond to Brandy appropriately, get her to the hospital and ensure she doesn't have a brain injury from an overdose, that she's not an AFib from her heart stopping, and all the things. What typically happens is someone's going to come to and be like, she didn't intend on overdosing. One, she's not going to feel real good about a bunch of first responders in her face. Please don't call the police. Don't take me to the hospital. She has got to go to the hospital because there's so many things that could be wrong with her from that overdose. She needs checked out. That's my like all the have-tos. To expand a little bit further. What is Narcan? What is naloxone? It's an opioid antidote. So it literally works like an EpiPen does to an allergic reaction on an overdose. And it reverses the effects of the overdose by allowing breathing and blocking the effects of other opioids in the system. It will not get a person high. I could squirt this in my nose right now and go about my evening just fine. Feel like Flonase or something. So the good news is that if this wasn't an overdose for Brandy and she was having another medical emergency, the good news is that I've already called 911. So when they get here, they can realize, oh, she had a stroke or, oh, she had a seizure or whatnot. And the Narcan is not going to do anything to hurt her, but it's worth a try. Here are different versions of Narcan. So sometimes EMS may arrive and they might start a Narcan drip to continue offering that medication. We used to see a lot more of the intramuscular Narcan where you get shot in the leg or shot in the butt with it, but that's not as easy to use and it's very intimidating. So we like the intranasal because it's real easy to use and we want people to feel comfortable doing it. It's easy to administer, easy to store. It's completely safe. This is what we use on kids all the way up until you're 100. We use this on animals. If you get a dog that gets into your medication or drugs or whatnot, Narcan's what they're going to use. It's the same concept as CPR and AEDs. It mitigates the damage caused by a negative reaction in the body. Here's my fun slide. I love this slide because I'm a nerd. So here's our opioid receptors in the brain. It looks like a cup, like a chalice, right? Here's my little bowl and my chalice. I'm an opioid receptor. I'm here and I'm ready for opioids. Okay. So I use opioids like a lot. I get too much and all my opioid receptors get activated. All of them are sending signals down my central nervous system saying, slow down, right? Everything's slowing to a stop. My breathing slowing to a stop. My heart slowing to a stop. I overdose. Narcan comes along and kicks all those red balls off the opioid receptors. So now my chalice is open again. I'm not activated anymore. I've stopped sending signals to stop breathing, and I put a lid on it. So all the other drugs in my system can't reattach to that opioid receptor and cause an overdose. So this little cap that stays on the opioid receptor only stays on there for about 30 minutes until it opens back up again. Now, even if I haven't used another dose and I still have fentanyl in my system, it's going to reattach to that opioid receptor and I can re-overdose. So another reason why it's important for Brandy to go to the hospital so they can monitor her. Questions on that? Okay. Naloxone laws. Justin Phillips in all her glory allowed us as laypersons to access naloxone without prescription and have a standing order for us to be able to access as much as we need. What it also does is it falls underneath the Good Samaritan law, like we were talking about with CPR. So if I administered naloxone to Brandy and I called 911 and I waited for first responders to get here and I participated in all of that, I'm protected from Brandy suing me for Narcanning her because she couldn't give me permission, right? Same way as like CPR. First aid cannot be like permissed because I'm unresponsive. What it's also meant to do is try to protect the administrator from other criminal offenses because people leave their friends to die because they don't want to get arrested. Happens all the time. People also get dropped at ER entrances and people drive off. Happens all the time. So naloxone law under Good Samaritan is the best we can do as far as trying to prevent that from happening. However, if I Narcan Brandy and I have drugs on me and paraphernalia when police arrive, I'm not protected from that, right? So there are some things there, but also know that like, that's kind of how the law stands. That's all I'm gonna say. How to access naloxone? Me or your friends at the rec center. So please don't go spend $50 at the pharmacy on Narcan. And I will, here's my soapbox. I'm going to get on this chair. No, I'm just kidding. Narcan is not free. There's a lot of stuff and talk online about why is Narcan free and my insulin isn't. Because it's not free. There are grants that people work very hard on to access the money to buy the Narcan for people that need it. It's grant funded. Grants are paying for Narcan to be free to you. That's my soapbox. I'm down off of it now. You can also get on overdoselifeline.org, request it individually, or there's nalox boxes all over Montgomery County on the outside of this building where you can access Narcan, no questions asked, because there's a lot of stigma with it, right? Like maybe I don't want someone seeing me get Narcan because I no questions asked. But I think it's important for everyone to have Narcan because I don't know if someone's going to fall out in the parking lot at Walmart. I don't know if someone's going to fall out here at the rec center. And it's important that we can respond and try to save lives because today's message is to end overdose. Questions on that? We've already went over naloxone administration. The only part I want to show you on here, unless you guys want me to slow down, is the rescue position on spot 6. Do not administer Narcan and leave someone on their back. They could vomit and aspirate, and that's an even bigger problem. So if you're not comfortable giving CPR to somebody that just had an overdose, please lay them on their side with their mouth open so that if they vomit, it's not going back down into their lungs. Okay. Oh, one more thing. If one dose doesn't work, you have to wait 2 to 3 minutes. Do not slam someone with Narcan back to back to back because you're scared. It is extremely painful to come out of an overdose, and it's even more painful if you slam them with Narcan. So it throws them into fight or flight, and it's important that we space that out. It's going to feel like the longest 2 or 3 minutes of your life, but it's very important that you do that. People are like, oh, don't Narcan, and they're going to come out swinging. They're going to get you. They're not going to get you, but they are going to be startled. They're not going to feel good. Give them their space, get out of their bubble and say, hey, Randy, it's Macy. I just Narcaned you. Are you okay? Do you need a glass of water? What's that? Empathy, compassion, space. I wasn't like, Randy, damn you, for using here. You know, because that's when she's going to be like, get out of my face, you know? And so just like common sense, right? Show some compassion, give them their space. All right. Thoughts, questions? I know you guys have sat here with me a long time. Okay. We can essentially wrap this up because a lot of this slides are things that I've already covered. I usually go over them before I even get to the slide, but I do appreciate you guys all coming out. If you have any questions or need to get in touch with me, I'm here. I'll be here for a while. But again, my name is Macy Simmons, and yeah, I'm happy to help. Thanks.
Thanks, Richie.
You're welcome.
Appreciate you. So everybody, we have t-shirts over here for everybody that came.